Good evening, everyone. If you are joining us on the telephone, we are calling thousands of your neighbors across Dutchess County for our telephone town hall. We're going to be live on the telephone with you for an hour tonight. This is County Executive Mark Molinaro. If you're following us now on Facebook, thank you for joining us this evening. Another busy day in and around Dutchess County, and we are in the second full day of fall, even though it feels like summer. But again, if you're calling in or we're calling you and you're on the telephone town hall and you have a question, dial 0 on your phone. You'll be sent to a recording. You'll ask your question, and then ultimately you'll be asked to come live with us on the call. So again, this is County Executive Mark Molinaro. You are joining thousands of your neighbors across Dutchess County on our telephone town hall, along with our Facebook Live town hall. If you have a question on Facebook tonight, we'll try to get to as many as we can. Please just ask your question in the comment window below the live feed. Remember, for those of you joining us on the telephone, dial 0, and we'll bring into the queue to ask a question. And just as a reminder, if you're on the telephone and for some reason you are disconnected and you wish to join us again, dial 845-765-7121. Again, if you are disconnected and you're on the telephone town hall, please dial 845-765-7121. It'll take a few minutes for us to call the 100,000 Dutchess County telephone numbers, and so that process is underway. If you're following us on Facebook Live, thanks for joining us this evening. Our next Facebook Live event will be Wednesday, September 30th at 3 p.m. 3 p.m. September 30th, live Facebook town hall, and then our next telephone town hall will be October 28th, Wednesday, October 28th, and that's at 5:30 p.m. Now, on October 28th, the telephone town hall will also include the release of the county executive's budget. I'm required by November 1st to present a budget to the county legislature, and to do that, as I said, prior to November 1st. We'll do that with you at a Facebook Live telephone town hall, and we'll get to some bullet points regarding the budget. So if you're being called now and you have a question, dial 0. If you have a question and you're on Facebook, please just fill it in the comment section below. And we'll get to you as many questions as we can. We're joined this evening again by Dr. Anil Waithian. Dr. Waithian is the commissioner of our Department of Behavioral and Community Health. That is, of course, our health department. Dr. Waithian is an infectious disease doctor, and we have used every ounce of his talent and experience these last 6 months. And we have been now 6 months and a week responding to COVID-19 here in Dutchess County. So why don't we jump right in with some of the information. But before we do that, we want to say thank you. Did I get that right? Thank you. To our sign language interpreters. Today, by chance, is International Day of Sign Languages. And we, as you know, take very seriously our responsibility to be as accessible as possible. And we have had wonderful interpreters join us these last 6 months. And I am told that I speak fast, which means they have to interpret fast, which likely means their hands are tired when we're done in the evening. So thank you. If you wouldn't mind, when you get a chance, thank them. And we're grateful for all the help they've given us these months. So jumping right to the county dashboard, we're at 162,000 tests conducted over these 6 months in Dutchess County. We're actively following 141 cases, and I'll get to that uptick in a minute, with 6 individuals hospitalized. Since the last time we came to you live on the telephone, we've had, sadly, 2 individuals succumb to the disease, so we are now at 156 total deaths, with 2 of those deaths occurring in the last week, and I'll get to that in just a moment. Now, overall, Dutchess County and the Mid-Hudson region is still at 1% transmission. There are some hot spots in Rockland County that are being monitored, and we do have an identified cluster of cases in the city of Beacon. So let's jump right to that, and to get you up to date on that, I want to advise that if you've been watching the dashboard, there has been an uptick in cases in Dutchess County. The majority of that growth and those new cases has basically occurred at the Hedgewood Assisted Living Facility in the city of Beacon. 13 residents have tested positive and 17 staff members have tested positive. Now, Dr. Wythian's on the call, and I'll ask him to talk a little bit about what we basically know, which is after I say what we basically know, and that is that we became aware of an initial case at the Hedgewood Assisted Living Facility about 2 weeks ago, just about that timeline, and reacted very quickly. We have a nursing home and an assisted living work group, rapid response team, that works directly with them. Now, these facilities are licensed entirely and overseen by the New York State Department of Health, but our health department reacted very, very quickly, working hand in hand with the Department of Health, the New York State Department of Health, and we've been monitoring them closely. Dr. Wythian, would you talk briefly about the order that you've issued, and then maybe some of the work we're doing with the state of New York, and then we'll probably take a couple questions. Go ahead.
Thank you, Mark. So as you mentioned, we saw an uptick in cases within the facility about a week ago, and we had, at that time, it gave us pause to think that there may be more cases within that facility. So we contacted our colleagues at the New York State Department of Health long-term care program, and had a discussion with them, and we felt that the whole facility should be tested. So in coordination with the state, we were able to have staff and residents tested in the facility, and as you mentioned, we discovered 13 residents as well as 17 staff members who were positive. And what we have done is issued quarantine and isolation orders to not only the individuals that have been found to be positive, but to the residents within the facility. We have also gotten word that occasionally we have residents who may not abide by these restrictions and may be outside the facility. So we instituted a commissioner's order, which we shared with the city of Beacon, so that law enforcement can sort of engage individuals who may be straying from the facility to remind them that they have to be on the premises.
So we are now tracking approximately 30 active cases at Hedgewood. It may have been up as high as 35, but we have 30 Dutchess County residents who are active cases at Hedgewood. We are working hand in hand with the State Department of Health, as Dr. Wythian mentioned, to have conducted the tests and now obviously conduct the contact tracing and monitor those cases. Dr. Wythian has issued a commissioner's order requiring quarantine of those positive cases and all residents at the assisted living facility Hedgewood in Beacon. As Dr. Wythian mentioned, we are working hand in hand with the city of Beacon. I want to express our appreciation to Anthony Ruggiero, the city manager, and to Lee Kiriakou, the mayor of the city of Beacon. They have provided support throughout this. We're grateful to the City of Beacon Police Department, as was mentioned, who is providing monitoring of the facility. It is necessary for residents to remain in that facility. Accommodations are made, certainly, but this is a critical concern. This is a population that isn't all seniors because of the nature of an assisted living facility, but it is a much more vulnerable population. And Dr. Wythian, I don't want to be morose or depress anyone, but this is a population where cases could become more severe, no?
That is correct, Mark. And we're also actively monitoring whether there's any spillover to the community at large, and we have not seen that to date.
Great. And so we're going to continue to monitor that, but that is the bulk of case increases in the city of Beacon, and really are the new cases. A good number of the new cases in the county as a whole. Now, again, remember, active cases, we're tracking 141. That is all the new cases, but after Dr. Wythian, 2 weeks of no symptoms, basically you're removed from the list. Remind folks what's recovered.
That is correct. If individuals who are contacts are on the protocol, they wait for 2 weeks. If they're without symptoms, they fall off. But cases, those that are symptomatic and test positive, after 10 days, we consider them non-infectious and not a public health risk, and so they fall out too.
Right.
Depending on active cases are monitored either through a phone call or through a texting system. Depending on what they send back in terms of symptomatology, that period of confinement can vary.
Thank you for that. And so, if you're on the phone call and you have a question, dial 0. There were several questions going into tonight regarding the Beacon numbers. Those are the Beacon. That's the jump, if you will, in the city of Beacon, and really the area of most concern for us countywide. We are not seeing widespread community transmission beyond this facility, and even throughout the county. We've hovered at this basically 100 to 120 active cases. Of course, that's jumped for the reasons that we've mentioned, but we'll continue to monitor them. If you have a question, dial 0. We'll get to you on the telephone call. Calling thousands of residents. We'll end up hopefully getting some live calls. If you have a question and you're following us on Facebook, write into the comment section below the live stream, and we will get to your questions. So we have a few Facebook questions. First question from Terry: is hybrid learning safe? Well, hybrid learning is safe. So hybrid is public education that's both virtual and in school. And some school districts are doing some in-person education. Very few are. Most are doing a virtual. My children are almost entirely virtual in the Red Hook School District. Dr. Wythian, do you want to? We expect that school districts will start based on their own planning. Students returning to school during the month of October. That many are going to return to some degree. What should parents be concerned about? And, we've generally said to folks that in-person education, has a degree of risk, but, the need to provide that public education is of critical importance, and therefore, sort of managing returning students to school is important to us. What should parents be aware of as they start to contemplate returning to school? Anil, do you want to just answer that?
I'll take a stab at it, Mark. Thank you. There's so many variables that are involved with regard to planning by school district, the staff, and the individual facilities themselves. But the one thing that parents can do is if they look at, their children and themselves as a unit or a bubble, if the only interaction is school and everyone is following the rules, that's one way to mitigate risk. Outside schools, if you're having, yourself and your children engaging other activities, large gatherings and all that, if you're able to limit that, then the likelihood of introducing COVID into the school setting becomes less. So I would really encourage individuals that are currently, and I commend them for that, for practicing all the mitigation measures that we have encouraged. And that is what's keeping the rate low in terms of conversion rates of cases and the tests that we're doing. If we continue to apply those mitigation steps, I think we could get through the school season, hopefully.
Thank you for that, and that's basically what we're encouraging, right? Is to take those steps, personal hygiene, be sensitive and aware of your health, your child's health. Don't send and we understand the stress. Believe me, families don't always have options, but don't send your child to school if they're experiencing any symptoms of a disease that whether it's the flu or COVID or any other. The goal is, of course, to keep and limit the transmission. Engage in those small gatherings. Try to stay in groups that and trust. Social distancing when out. and also, of course, wearing a face covering. We're going to go to Jessica. Jessica had a question on the phone regarding Halloween and the county's position, and it's probably a good transition from school activities. So, Jessica, go ahead. Are you there, Jessica? We may have lost Jessica on the phone. I hear a voice, but I don't know that if you're not there. The question, though, was in regards to Halloween and what's the county's position on Halloween. The county's position, we announced, or we said sort of 2 weeks ago, we basically said we believe Halloween activities, although with precautions, can happen safely. We're grateful the state of New York followed suit. I'm not saying that we saved Halloween, Anil, but it's possible that Dutchess County saved Halloween. But there are some safety steps that we want people to take and to be careful of that. So keep in mind, the state has said that there's not going to be any outright prohibition on traditional Halloween activities, trick or treating or what have you. You likely know the Center for Disease Control, CDC, issued some guidance last week. People have asked me, the CDC guidance is that. It's guidance. It's meant to give us direction. And keep in mind that even in the state of New York, where we have a lot of these very strict restrictions still, not all of them are supported entirely or at all by CDC. Certain risks have been taken to accommodate certain business types and activities. But then again, the CDC guidance is important. But at the heart of it, it's about being safe and being smart. Anil, are you prepared to talk a little bit about some of the things families should be aware of going into Halloween? And as I ask you that question, I will say some of the things we want you to be aware of, and then Anil can follow up. I like to give him a second or two to get his thoughts together. We want you to be safe. So my kids are going trick-or-treating this year. But we're going to do it in a neighborhood and among houses and families that we know, we see often, and have basically followed the guidance. And it's not to say others haven't. It's to say I know that these have. So in that case, keeping the group small, it probably only be a couple of it'll be my kids and a couple of their friends. It won't be a time to go out in large groups. Try to stay close to homes and in a neighborhood that you know. If you're giving out candy, there's a couple ways you might want to do that, right? For instance, I have a nice front porch. We might put the candy out on the front porch and just let kids get them without having to necessarily, make anyone uncomfortable coming to our door or vice versa. If you're a vulnerable population, senior, maybe you have an underlying illness, maybe you want to keep the candy out, in front of the door and talk to your guests through the window. A lot of communities do what's called trunk or treat. So maybe you want to fill the trunk of your car, which could be frightening in of itself, with candy, and kids could take those. Or as some have done, and we may in fact do, we have a very large tube that my wife has from a mail package that we got, and the kids use it for Hot Wheel cars. Well, my three-year-old son Eli wants to launch candy through it from the front door. So those are sort of the creative things that you can do to be safe, but being safe. But Anil, the questions that a lot of people have been asking is, well, a traditional Halloween mask isn't really a mask, and should I wear a mask under my mask? What are your thoughts on Halloween?
Sure. I think, Mark, you bring up some reasonable measures that people could take. But I think the most important thing that you brought out is to have a plan. If you know your route, if you know your neighborhood, if you know the houses you will be frequenting and going to, that sort of, takes out some of the uncertainty. The other thing is children, again, I would advise parents to actually supervise them as they're going out trick-or-treating so that, again, they are adhering to those preventive measures that we are hoping that they follow. With regard to masks, Halloween masks do not have, the typical Halloween mask anyway does not have a medical benefit. So, wearing a surgical mask or some form of face covering underneath probably would be beneficial. I would also add that our communications group, led by Colleen and also staff members at DVCH, is working on FQA, frequently asked questions.
FAQ.
FAQ. Thank you. Frequently asked questions as well as guidance with regard to trick-or-treating, and hopefully that will come out fairly soon.
Fair enough. And so trick or treat, this would be a great year to do it as a family, right? So if maybe in the years past some of the kids will get a little bit older, you let them out on their own. We would encourage you to do it where you're out with your kids, sort of monitoring and overseeing and really participating and in a way that might be something different and nice. This might also be the year that if you wanted to, you could be a frontline worker costume. This is a great year to celebrate and give credit to those doctors and nurses. And I don't know if there's a public health costume, but nevertheless, you could be Dr. Wythian for Halloween if you wish. There are no Mark Mullen.
Hopefully not.
Hopefully not. It's be spooky. Or Mark Molinaro masks. But nevertheless, this is a year to be a little more creative and obviously to be a little bit safe. But go out there. We want people to be safe and to do it safely, but to have a little bit of fun and be a little bit of creative. I'm going to go through a handful of Facebook questions very rapidly so we can kind of catch up. Beth has asked where someone without symptoms can get tested. Anyone can be tested now, right, Anil? You just have to visit dutchessny.gov, and we'll point you to those testing locations where you need a prescription, but you don't necessarily have to be symptomatic to get a test.
That is correct.
And there are a good number of pharmacies that provide those testing, although I think, Anil, you would remind folks that pharmacies in particular, their testing doesn't always get you the results as quickly as some of the other lab-based testing sites. Is that fair?
That is correct. Oftentimes, if tests are done, the lag is really transport to the lab, and that turnaround time is prolonged by some sites, especially at some pharmacies.
Terrific. Corinne has asked, some colleges are not tasting, but testing wastewater. That would be awful. Testing wastewater for COVID. Anil, you remember we talked about this early on in this crisis or this pandemic. This concept of testing wastewater is a way of identifying perhaps where the disease might be transmitting. And as I understand it, those colleges are principally SUNY schools in New York. They're principally SUNY-based schools, state of New York schools, where they have direct access to lab resources. So we don't necessarily have one in Dutchess, but I think that SUNY New Paltz, one of the local regional schools, is doing that. Anil, what's the benefit of testing wastewater?
You know, has been done, epidemiological studies looking at resistant organisms for quite some time. But when you look at what's happening on the SUNY college campuses, if you're able to selectively sample from different dorms, you could tell which dorms are being affected by COVID as you compare them. If you just do general sampling of a large pipe that goes out from a campus, it's not as instructive as if you do selectively from the dorms, particular dorms and locations that students may be residing in.
So it's a bit of preemptive contact tracing.
That is correct, meaning if they're able to identify which dorm is having, and they could do quantitative analysis, meaning they could have some guesstimate of how many students may be positive. And so they could take steps like closing down or quarantining that dorm.
Thank you for that. And Cheryl asked if senior centers are going to open. They are not going to open too soon. I would be shocked if we are able to open them up again before the end of the year. I just think that at the moment that is likely not going to be something that you see happen in the traditional sense, although our Office for the Aging is doing a lot of work to provide services to seniors virtually and in larger settings, but it's not likely that we see the senior centers locally reopen in the near term. This is the most vulnerable population. The issues in Beacon, a good example of how quickly the disease can rear its ugly head and transmit quickly through a population, in particular senior population. There was a question again regarding the Beacon and the numbers. Let's go back to the dashboard for 1 minute. If you're watching on Facebook, 141 active cases. These are the cases we're monitoring. 6 hospitalizations. So of the 141 active cases being monitored, 6 of those are in fact hospitalizations. And of the beacon numbers, I'm trying to see on the dashboard, what's the beacon number currently? You're in the P's, so we have to go backwards. Beacon is 45. 35 of those are, we know that 30 of those are Hedgewood related. We do know that. So that's the basic information we have at this point. And those, again, the bulk of the beacon numbers and the bulk of the growth in active cases are those 30 to 35 total Hedgewood-related cases. Amelia asked, will a parent at higher risk who wants to do virtual learning all year be penalized? Amelia, no. School districts are being told that no matter what happens with restoring, that individuals who are higher risk and have vulnerabilities have to be accommodated virtually. That's part of the governor's order. Now, how that happens, I don't know entirely. For instance, it may be that your child's class may convene. There might be 6 or 8 kids in the classroom, and your child may continue to sort of visit that classroom virtually. So be aware of that. Raphael asks, are schools addressing air quality? And the short answer is yes, to the extent they can. Anil, are you comfortable talking about some of the filtration issues that school districts were addressing, or do you want me just to give a general answer?
I'm not versed in what modifications they may have done with the air handling system, so I think I would
defer to me. So what I know of the conversations we have with school districts, the short answer is all are trying to create greater airflow. So some during the warmer weather, you probably, if your kids are attending, you'll see windows open, you'll see larger fans, doors will be open, so there'll be the constant flow. Some districts were able to meet the HEPA filtration standards that some have recommended. Others have made modest improvements to address. But again, these are not buildings that were ever made in most cases to address a lot of these situations. So all are doing that. Some schools are doing in-person intents outside, creating obviously the open air situation. So all of that is being considered. But yes, there's always the risk when we start closing doors, closing windows, and people inside. That's true with any infectious disease, and this, of course, being one of greatest concern. We're going to go to Anne Marie in a second, and Dr. V, what's that? Anne Marie's going to be on the line. Anne Marie, I'm going to ask you to hold 1 second because I want to get through a couple others' Facebook questions. Todd, will this virus be over? Well, the short answer is, no virus is ever over. I mean, we have sooner or later we'll have medical therapies and vaccines to control the spread, and something called herd immunity. And Dr. V, I'll get to you in a moment. I want you to talk a little about what herd immunity is, but it'll be over when we're able to manage it more effectively, and we're not seeing the growth in the hospitalizations and certainly the illness spread as severely. Crystal asked, is there more to phase 4? That's a governor's decision. There are still businesses we want open. Theaters we think can open safely. Event venues we believe can open safely, but there are steps that need to be taken. So we are sort of stuck in this still sort of wait and see, and that is entirely on the governor and the state of New York. We'll work with anyone to try to move things along, but that is a decision that they make. We're obviously advocating. Just had an event with some theater owners in northern Dutchess. We think movie theaters can open safely with certain restrictions. We don't see necessarily major concerns in other states, but here we are. Anne Marie had a question. Now, this is somewhat personal, so Anne Marie, I'll let you ask the question, and then Dr. V or I can try to answer it. Go ahead.
My son is a resident at Hedgewood, and I'm very concerned about the number of cases.
Understandably, and I didn't want to say...
Has everyone been tested in that building?
It's a good question.
Because I know some of the residents aren't aware of the seriousness of the illness or even that it exists.
I know that we're dealing with a population there that some of this is difficult for us to communicate and explain. Dr. V, why don't you talk through the steps that the state has taken with the owner and what we're sort of monitoring? What is this survey, and how many people are being tested, and what are the steps specifically that were taken to address? And I might say, Anne Marie, every resident was to be communicated with, or their immediate family communicated with in some fashion. We're finding that some of that information didn't get necessarily to loved ones, and we're we're obviously pushing on the state and the property management to make sure that happens. Dr. V, what are the things that residents should know there and their family members should know about testing, et cetera?
So when we saw an uptick in the number of cases, as I mentioned before, in coordination with the state, there was mass testing of that facility. And so those individuals that are positive are cohorted, meaning separated from the general population so that, there's no opportunity for continued transmission within that facility. And if other individuals are found to be positive, they will be cohorted also. But we are looking and monitoring for the next 2 weeks for those. We're considering the entire facility as, as exposed, even if they tested negative. So they have a 2-week window where they potentially can become symptomatic or test positive. So we are following up with not only the state, but also the administration to make sure that the isolation and quarantine measures are diligently followed and transmission opportunities do not exist in the facility.
And if one tested positive, they and their immediate contact or loved one would be notified, certainly, that they tested positive. Is that correct?
Mark, that is correct. The state regs dictate that regardless if there is a positive, everyone in the facility has to be notified. What has occurred is the positives were contacted personally by phone, and they may have used sort of like electronic means for the non-positives to be communicated. So this was discussed with the state, and we're following up with the facility administration to make sure that everyone's notified.
Terrific. Thank you, Anil. Jessica asks when restaurants' capacity will go up. I mean, the short answer is we don't know yet, but what we're pushing for, obviously, is to give the greatest latitude to restaurants as we enter into the time where weather changes and outdoor dining is not going to be an option. But then again, there are the concerns about being in those confined areas. So at the moment, the state has not said, but we are, as a region, making the case that there needs to be accommodations, and we can't wait till November 15th to figure that out. But we are in Dutchess County. We've extended and will continue to extend my executive order. I have an emergency order that permits outdoor dining. In fact, eliminates all of the local reasons that outdoor dining might not be permitted in municipalities. Supervisors and mayors across Dutchess identified what those obstacles were. We signed an executive order that waived them. And so outdoor dining will continue. Conveniently, it's still a little bit warm out. But we are pushing to make it easier for businesses as we get into the colder months. Susan asks, are there guidelines for ERs allowing relatives in with patients, especially a senior? Anil, if you don't know, it's fine, but I'm led to believe that hospitals have made accommodations again for emergency guests, if you will, or individuals who might need to be with a patient in an emergency setting to join them in that emergency setting. Do you know that for certain?
I do not know that for certain for all facilities, but I think I would encourage individuals to reach out to the patient advocates or the facility's ombudsman to make sure that they try to accommodate those requests. They might not be able to accommodate all requests, but especially individuals who are in dire medical conditions, they will go out of their way to sort of accommodate if they can.
Thank you for that, and I know that the restrictions on visitors has been alleviated to a degree. Let me get through a couple updates. We talked a little bit about Halloween. As you know, the states of New York, New Jersey, and Connecticut have issued these travel advisories. There are states that if you travel the state of New York, Connecticut, New Jersey, expect that you will self-quarantine upon returning, or if you're traveling from those states, you'll self-quarantine here when you arrive. No states have been removed, but there have been several added. No states have been removed this week. However, California, Hawaii, Maryland, and Ohio removed after last week's town hall. So California, Hawaii, Maryland, Ohio off the list. Diane, you get to go to California or Hawaii now. You're welcome. They hate when I do that. And the states of Arizona, Minnesota, Nevada, Rhode Island, and Wyoming have been added. Those are the lists. I will tell you that my family traveled briefly to Maine last week. Yes, we took a couple days off, although days off is not really a definition. It was just days not here. We worked through them. In fact, I spent a lot of time talking to the departments regarding Hedgewood, but nevertheless, we went to Maine. Maine is not on the list, but still wanted to be safe about that. In fact, I ended up taking a test before leaving so that I was certain. And of course, I tested negative and went off to a few days in Maine. That's just for your own information. Marie asks, are group substance abuse therapies safe? I mean, to the extent that those are small groups, they're safe, but there's always a risk. Anil, we want people who are dealing with substance abuse issues to rely on their therapists and their programs. Right, our own services are available 24/7 via telemedicine and telephone. But if you're dealing with a mental health or a drug addiction, Anil Wythian, we want you getting those services. What would you say about that?
That is, Mark, that is absolutely right. It's been well showcased that individuals with medical conditions, and now we are absolutely certain that individuals with behavioral health and mental health issues have been not availing themselves of the care that they need during this crisis. And we really encourage to connect with their caregivers, their providers, and to seek help that they need and not wait or feel that they shouldn't go seek care.
And just as a reminder, if you are dealing with a mental health concern or substance use disorder, we have in Dutchess County perhaps the most comprehensive network of services. You have to use them. And available to you is helpline. That is 845-485-9700, 845-485-9700. That is 24/7. Mental health, addiction professionals on the other end of a phone or text. And the Dutchess County Stabilization Center is now again open for walk-in services, and we're grateful to our team and partners at Mental Health America, People Inc., and others who have or People USA, I guess it is, who are providing those services. Grateful for that. We're going to go to Gloria. Gloria had a question. She's on the phone. She wants to know a little bit about how you contract the disease. Gloria, are you with us?
Yes, I'm here.
Jump in. What's your question?
Good evening.
Good evening.
Well, my question, I'm 80 years old, and I up to now, I don't know how you caught that thing.
How do you catch that thing?
Yeah. How
Anil?
do you catch it?
Well, I have.
That's for the doctor.
Yep, and I've got a doctor for you. So, Anil Wythian, how do you catch that thing?
Yes.
So,
how do you catch that thing?
Good.
So the most common ways to catch it from someone who has active disease or potentially has that virus and can transmit. So the type of activity that sort of puts people at risk is sort of close physical contact with individuals who are positive or sick from the disease.
There you go. Keep your distance, wear face covering, and good personal hygiene. Good time to remind people that we obviously spent a lot of time, and rightfully so, talking about COVID, 6 months of responding to a pandemic in this region. But we're also around that time where people start to think about and worry about the flu, rightfully so, traditional, normal flu. If you're of the mindset, get your flu shot. I get mine every year. Yes, this is the time where shameless pictures of politicians getting poked. I often wonder if they're actually giving me the flu shot or just putting a needle in my arm. But that is our public health team. And if that's your choice, it is your choice to take the flu vaccine if you'd like. Please do. It's the time of year to think about that. Lyme disease and prevention, also time to think about that while you're outside. Ticks are now adults, and they're active this time of year. Information that I bet you didn't know that. There are adults right around now. They're in the waning years of their life, but they're also very active, and it's not a joking matter. We want you to take precautions to prevent the spread of Lyme disease, contraction of Lyme disease, and other tick-borne illness. Wear clothing that covers up open, skin, if you will. So now's the time to tuck if you're out in the, out on tall grass or in the woods, or perhaps you're you're headed off to one of those corn mazes or something. You may even want to tuck your pants in your socks. You want to wear longer clothing, repellent, and do tick checks, please. It's a great time to do tick checks. I can tell you the importance of that for yourself and for children and pets. Always a good time to do that as well. Jen asks about the 1% infection rate. Is that just for Dutchess? No, that is in fact the Mid-Hudson region transmission rate or infection rate, 1%. There are certain counties a little bit higher, some counties a little lower. I think Dutchess is about at, what's that? We are at 0.5%. Oh, we're at 0.5% transmission rate in Dutchess County. Okay, well, there you go. We're at 0.5%. As we mentioned, Rockland, I think maybe Orange, maybe over 2. Rockland's over 4%. So that balances out. New York State's about 1.2, 1.3%, I think, statewide. That's the regional rate. Sherry and Kathy both have voting questions, and we're going to get to that in just a minute. Dr. Wythian, Gary asks, should I turn kids away with no face covering for Halloween? Gary, I think our suggestion for Halloween is take steps where you don't have to do that. I think that's fair. I mean, I think we want kids to come up with, and families to come up with creative ways, certainly to celebrate Halloween. But I really don't think that you want to be in a position of saying, go home. My suggestion is, and our suggestion is, create a way that maybe if a child doesn't have a face covering on, or you're not comfortable opening the door, maybe there's candy next to your door, just outside, where they can pick up, and you can just say, hey, do you mind just picking from that basket? Or you can do the Eli Adams Molinaro test, which is a giant tube where candy will be slid out the door by him. So there you go. Those are options. Does that sound fair, Anil?
Those are creative and really reasonable ways to deal with some of the concerns that you have. And
it's Halloween. Come up with some fun and scary ways to give out candy that don't necessarily require you to get so close if you have a concern, right? Like we said, trunk. You can open your trunk. You can put something scary in there, I guess, and encourage people to get candy out of the back of your car. There are a lot of ways to do it. Please do that. We don't want to create a scenario where kids are turned away, crying, or families are arguing. We have enough of that going on in the world. Right now, let's just be safe and as safe as we can. Melinda asked about who's overseeing school districts and school district plans. It's a little bit of everyone. Neil, why don't you talk about Dutchess County's team? We have a group that works with school districts.
That is correct. So, Mark, from your leading and earlier on, we've been having ongoing conversations with the school districts, talking about everything from, screening to environmental controls to administrative controls, how to deal with symptomatic individuals. So that conversation has started months ago, and now we sort of have protocols in place. And now that schools are opening, a lot of the dictates and demands are coming from state ed. But we have been in discussions and in coordination with school districts from way back.
And the state of New York provides a degree of oversight through the state education department, New York State Department of Health, and you can monitor those plans at least online. So we're going to get to a few questions. Why don't we go to Richard about absentee ballots, and that's a good time to kind of wrap all of our voting questions into one. Richard, do you have a question regarding absentee ballots?
Yes, I do. I was curious about any updates in terms of when ballots will be mailed out for those who have already applied, and whether there's any update in terms of the drop boxes.
Great questions, and I'll mention that Kathy asks when are absentee ballots being mailed, to your point, Richard, and Sherry asked about ballot tracking in the county or throughout New York State. So let's go through the basics on voting this year. Yesterday was National Register to Vote Day, so we hope that you may have done so. However, if you are not yet registered to vote, you have until October 9th to do so. My birthday is October 8th, and I would want no gift more than to see everybody who could register to vote. Yeah, I know, we're getting punchy. October 9th, you must have your application postmarked or hand-delivered to the Board of Elections in order to be a registered voter in the state of New York, here again in Dutchess County. 3 ways to vote. You can vote by mail, you can participate in early voting, or you can go to your traditional poll site. Voting by mail. You must now request your absentee ballot. The deadline to request a general election absentee ballot is October 27th. That's the deadline. If you do not get by mail, you can postmark it. You can come in person, I think, still to get it. But if you're doing it by mail, if you're applying for absentee ballot for this November election, you must have it postmarked and into the Board of Elections by October 27th. And there's no harm in applying more than once. If you applied early and you're not too sure if you're in that window, you could still apply. You'll get a ballot. Number 2, ballots will be mailed this week. So the ballots will start going out to voters this week, to Richard's questions and to the others. So you'll start seeing them. If you've applied for an absentee ballot and you don't see your ballot in a few days, in a week, you can call the board, you can apply again. There's no harm in doing that. They are tracked by the county's Board of Elections. We've got a professional team there, led by 2 terrific commissioners who work very, very hard to make sure that the absentee balloting works. We're experienced with this. To the question about a tracking system, as I understand that the United States Postal Service is launching some sort of tracking mechanism, but I don't know what that is. So my suggestion to you at the moment, you're likely to have gotten a card from the post office. Monitor that. If you have a question about your ballot, you want to reach out to the Dutchess County Board of Elections. So those are your options. That's how you finalize and monitor your absentee ballot. Again, you have 3 options for voting this year. Vote by mail, as we've just discussed. There's also early voting. Early voting starts October 24th, which, by the way, is after the presidential debates, so it gives you some time to digest whatever was or was not said during those debates. And the first one, I think, is next week. And you can vote early at one of 5 locations. No matter where you are registered in Dutchess County, you can go to Rhinebeck Town Hall, Millbrook Firehouse, the Dutchess County Board of Elections in Poughkeepsie, the Boardman Road Branch Library, or Fishkill Town Hall. Any one of those locations from October 24th for 8 days. There's 8 days of early voting. So it's, what is that, right through Sunday, I think, before Election Day. So the 24th through the 31st of November. I'll confirm that in a second. I think it's the 31st, Sunday the 31st. You can vote early at any one of those 5 locations I mentioned, and then, of course, you can vote on Election Day. Now, to the point of all of this monitoring, if you voted absentee and then you show up on Election Day and you vote, your absentee ballot will be denied and your in-person vote will be counted. So no matter whatever option you take, your vote is somewhat monitored in that way. And again, absentee early voting goes until Sunday, November 1st. Thank you. Sunday, November 1st, and then Election Day is Tuesday, November 3rd. And you have those options before you. Tonight, we're hosting our thanks to our heroes, and we have our frontline movie tonight. Obviously, I'm not there, and maybe you're not either, but a great drive-in event, Back to the Future, one of my favorites, at the Overlook Drive-In tonight in a half hour. So if you still have time and you're a frontline worker over these last 6 months, whether you were out there driving trucks or operating cash register at a grocery store, or you're in a hospital or public health setting working hard, we invite you to join us, and we want to celebrate and thank you for that. So for that service, Back to the Future, tonight, 7 p.m., Overlook Drive-In in the town of Poughkeepsie. Dan, where do you stand on school sports being delayed? I happen to think that I coach my son's soccer team. I think that there's safe ways to manage school sports. Not a decision I get to make. These division and organizations get to make those decisions. Dr. V may have a different opinion than I do. I think they're safe to manage. Dr. V, school sports, what's your opinion? You can disagree with me.
it all depends on the type of activity. So it's all dependent on how close individuals come into contact and how long. So, you know what? I'll leave it to people with a lot more experience in this than myself.
I think the point is that everything we do in this environment or any environment has a degree of risk, and how we mitigate and minimize that risk is what's important. And I was with an educator the other day who said, listen, we have to have the courage to do what's right for our kids. Now, what he meant was we don't have to have the courage to fling open the doors and just pretend like the disease doesn't exist. That's not courage. That's stupidity. And it's not have the courage. Everybody stays locked down because we'll never go back to living independently. It was the courage to figure out how to do this. And so, my position has been there are ways to be safe, and we ought to figure those out. And if you can have sort of the public recreation activities that are occurring now, as I said, my son plays soccer. Baseball's underway. I know Assemblyman Kieran Lawler coaches his son's Little League team or baseball team. I don't know if it's Babe Ruth or Little League. They're playing. There's a way to have school sports function safely. But those divisions made those decisions. If they had made a different decision, we'd be right there providing them some guidance and assistance. Joe asks about contact tracing. Is it working? Dr. V, is contact tracing working?
Yes, it is. And I would put a caveat there. So I want people to have realistic expectations by contact tracing. There will be some degree of community transmission that's going on. That's the background transmission. What contact tracing is very good at doing is making sure that, as we spoke about Hedgewood now, once we identify cases, that it doesn't grow, it doesn't become a cluster and spill over to the general population or the greater community. So in that respect, the case positivity rate speaks for itself. If contact tracing was not working, we would see our numbers climbing.
And so, and we've got a great team of both staff, public health staff. We are using some of our Medical Reserve Corps volunteers, doing a great job, and of course, the state of New York's tracking contact tracing system has been very helpful to us. So we're moving along in that direction. I want to get to Beth in Millbrook on the phone. Beth had a question regarding people getting the virus twice, I think. Beth, go right ahead.
Yes, I've heard a lot about what confers immunity. If you've had it, are you immune? And can you get it twice? I mean, more than once. And are there documented cases of people who have had it more than once?
That's a great question, and thanks for asking it. Dr. V, could you answer that question? And then while you answer that question, tell us what the heck herd immunity is and how do we get it?
Sure, certainly. So again, to your question, there has been documented cases of individuals who have been found to be positive for COVID at least 3 months apart. But the things that should be noted is, to date, we have not had any major reports of people becoming seriously ill twice. Meaning, if the initial illness was symptomatic illness, they may have tested positive 3 months afterwards and found to be positive again with, maybe even a different strain genotypically, but they don't necessarily become sick from that virus.
And what is herd immunity?
With regard to herd immunity is when you look at a population, and if herd immunity is done naturally, then a certain percentage of the population, typically depending on what the pathogen is, between, say, 60 to 70% of the population develops the illness, recovers from the illness, and develops immunity. So that if that many people have the illness and have recovered, then, when you introduce individuals into that population, they potentially are bumping into others who are immune, and therefore you're not going to see ongoing transmission. So herd immunity is when you have sufficient percentage of the population with immunity so that transmission is not sustained in that type of environment. I will tell you and caution people that natural herd immunity for the United States with regard to COVID, we're talking about at least 200 to more than 240 million people becoming infected with this virus.
So that's a good, right, that's, oh, good. Yeah, good. Good point, yeah.
Yeah, to date, we don't believe that more than 20%, some places like New York City, the percentage is higher, but to date, we do not believe at least even a quarter of the individuals in this country have seen the virus. So there's a lot more people who potentially can come down with the virus and get sick. And if you leave it to natural herd immunity, if you're talking about roughly 200 million people or more who potentially could get sick, even if only 1% has a fatal outcome, that is catastrophic.
And so a vaccine and vaccination, if one chooses to take a vaccine, how does that affect herd immunity?
So again, apart from natural herd immunity, if you vaccinate the population and you vaccinate, say, more than 2/3 to 70% of the population, again, if you introduce the virus into that population, that a sick individual more just by probability and chance will bump into other people who may be immune, and the virus doesn't have an opportunity to find people who are susceptible and therefore perpetuate that illness. So vaccine works just as well if it's an effective vaccine to prevent transmission within a community or a population.
Thank you, Anil. I have to say, we have a couple more minutes to go. We're going to push a little bit past the hour. That of the 6 months you and I have been doing these telephone town halls, that may have been the most informative 2-minute answer that we've had. I think it's important to understand that you don't get to natural herd immunity unless a lot of people get sick, a lot of people. And the vaccination, for those who choose, assists in sort of escalating and sort of speeding up that herd immunity, not natural, of course, but done with the vaccine. And that's a choice that people make. But that's I think what we need to understand. You don't get to herd immunity unless a lot of people get sick.
That is correct, Mark.
So Lisa asked, should we have received STAR checks? Some people, no, the short answer is you're not likely to have gotten a check from the state of New York anytime recently. Keep in mind the federal government may consider some stimulus package that may include individual checks to residents. The state has not distributed those, and most people, I think, have transitioned from an outright check to a tax credit, and you have to know which one you fall under. But I'll do this for you. The next time we're going to start next week talking a little bit about the county budget, and as we do, we'll talk a little bit about some of the other resources that you should be aware of, and I'll get you an update on STAR and what that is. As we have you, I want to try. Let's try one last question. I think Cookie asks. Cookie had a question regarding Airbnb and bed and breakfast, etc. Are you with us?
Yes, I'm here. How are you?
I am great. Go right ahead. What's your question?
Well, I noticed the influx in some homes around where I live. There are Airbnbs. And I was just wondering, are people being required to be tested before they come from out of state or even from out of town? I've just seen a lot of out-of-state plates around here lately, so I was just wondering what was going on with that.
Great question. So the travel advisories the states of Connecticut, New Jersey, and New York established require that there's not a pre-testing requirement, but if you come into the state of New York from any of those locations, those states, you are required to self-quarantine, which means, in theory, if you're coming to a bed and breakfast or an Airbnb, you have to be there for 14 days. Now, that's not entirely likely. However, if you've traveled in from other states, you're being asked to complete a form. The State Department of Health advises that you must self-quarantine for those 14 days. And then for those that are traveling from within the state, there is no pre-testing or even quarantine requirement unless you believe you may have contracted the disease. So there's a little bit of fluidity there. But I will tell you that what we're seeing in general is those lodging facilities, those travel places, Airbnb and otherwise, They really are putting a great premium on the disinfectants and the cleaning, and we aren't seeing that much. We are seeing some travel-related transmission. Dr. V, do you want to just? This will be the last question we take from the telephone. And then I want to get to census. Don't hang up. I have to remind you about the census. Don't leave. Very important. But Dr. V, travel transmission, we're not seeing a lot of that, although we do have some Dutchess County residents who've traveled elsewhere come back are positive, and of course we monitor those.
That is correct. So we're seeing a smattering of cases related to travel. But again, it doesn't seem to be overwhelming in terms of the numbers.
And so that transmission rate holding at 1%, very positive for us. And again, while we're concerned, and it is a critical concern at Hedgewood, we are not in Beacon. We are not seeing widespread community transmission, even through those visitors and what have you coming in and out of the community. Ariel asks about when absentee ballots are counted. That's a great question. They are not counted until the polls are closed. In fact, they begin the process the next several days. So good point. For instance, if you voted absentee and then you end up still voting up at the polls, your poll vote, you show up at the polls on early voting or on election day, that vote is going to count and your absentee ballot will be voided. And then they begin the process of conducting the absentee ballot counting. So be prepared. I'm going to tell you this, unless it's a blowout, and I'm doubtful there's going to be many blowout elections, but there'll be a handful. But most elections this year, we are not likely to go to bed on election day knowing who's won, because there's a lot of counting that has to happen. And that's not absurd or unusual. We have this happen almost all the time in local elections. So there are a couple things you should know. Early voting tallies will be automatically inputted in the system on election night. So the polls close in New York at 9 p.m. The very first votes you're likely to see on the website, or if they're tracking them, are all the early votes. Those are the ones that you went to those poll sites, those 5 locations, and you voted early. Then you're going to start to see the counts from the polls that night. The voting, you went into the machine, you voted that day. There it is. It's going to start populating on the county's website. And then over the course of several weeks, absentee ballots will be counted. So unless it's a clear victor, it's going to take some time. And you know what? It may not be the worst thing. It may be necessary for us to cool down and let the process play out. But I can tell you the paper ballots and the absentee balloting in this county tracked very, very carefully. And of course, we continue to encourage you to choose. If you wish to vote in person, you can do that. I'd encourage either election day or early voting. If you don't want to be worried about the lines and you don't want to necessarily be in a small environment, you might vote over the course of those 8 days, 9 whatever days. Early voting, October 24th to November 1st, might be best for you. I'm likely to vote early because I don't want to be on election day. Dr. V calling me and telling me we've got a problem, so and miss my opportunity to vote. But my wife's going to vote in person on election day. Those are your choices: absentee, in person, or early voting at those locations. Census. We are in the last few days of completing the census. It is so critically important. Visit U.S. Census. myuscensus.gov, yes, you can do that, or 2020census.gov, sorry, 2 websites, 2020census.gov, 2020census.gov. Please, if you have not completed the census, it is important. Why is it important? 3 things that you should know. Federal dollars are distributed based on population. If we lose population as it compares to upstate, downstate, or Texas, we lose the resources from the federal government. A lot of money go to a lot of places. Reapportionment, congressional representation. If you're sitting at home thinking, gosh darn it, I'm so tired of downstate having all the votes, or we don't have enough representation in Congress, that's important. More people in Dutchess County, the stronger our vote is with a congressional seat. And your own reapportionment, state legislature, county legislature, all determined by the census. Please visit 2020census.gov. And this is our challenge to you. Our response rate right now, 66.3% of the county residences have completed their census. That's great. That's as of September 23rd. The 2010 response rate was 65.7%. We need to beat that. I want us up at 70%. I want us at 100%. So here are the communities. This is not, I'm not bullying you or shaming you, but town of Northeast, shake up the trees, go out in the community and tell people to participate in the census. You're at 49% participation. And the north side of the city of Poughkeepsie, come on, get working. 31%, 41%, 45%, still too low. In particular in Poughkeepsie, please, if you're watching, very critical. The city relies a great deal on state and federal aid that has everything to do with the census. So finish the census and listen, the town of LaGrange is at 76%. Do not let them be unchallenged. You know, you don't want to be sitting at home in Dover saying, those people in LaGrange beat us on a response. You don't want to be in Poughkeepsie saying we lost to LaGrange. Who wants that to happen? I'm really going overboard, but we do want you to participate in the census. It's really important. It really is. Please visit 2020census.gov. I apologize, but please get those response rates up. Challenge your neighbor. Ask your mother, your cousin, your aunt, your uncle. Did they complete the census? Please do that. 2020census.gov. We thank you. Please remember our next Facebook Live event is 3 o'clock on September 30th. And our next telephone town hall is Wednesday, October 28th at 5:30. We're going to start talking next week a little bit about the county budget. Tough decisions are going to have to be made. We're confronting massive loss of revenue, but the commitment we're making is not to shift our burden onto property taxpayers. So we're going to develop a budget that does not raise the county's property tax. We have 150 people took the early retirement incentive, saving millions of dollars. We're very grateful for each and every one of those employees that participated. We've made some really tough challenges together, tough choices together. We're going to keep at it together. At the end of the day, we have lived through a lot. We've lived through this pandemic together. We've mourned the loss of life together. We've seen far too many violent acts together. We have celebrated great successes together, and we are going to get through this budget challenge of ours together. So with that, ladies and gentlemen, please, we look forward to next week. In the meantime, if you have any questions, please reach out to us. Visit dutchessny.gov. And in the meantime, keep safe, be healthy, and be kind to each other.